Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com. AUREUSmedical.com.
NPTE StudyCast.
Welcome to NPTE StudyCast. I'm your host, Jimmy McKay. On the program now is, Sarah Haig. Sarah, welcome to the show.
Thank you so much for having me.
Always good to have someone on the program who has got more energy than me, which is very few people, but I think you're one of them.
I think you're overestimating my energy levels, but I will take that as a compliment.
When someone asks you what you do, Sarah, how do you describe it? You do many things, but what do you do in this field?
In this field, what I get to do is to help people with the things that nobody else wants to talk about. So I love doing all of the pelvis, and that pelvis is attached to the rest of the body. So I like talking about the function of bowel, bladder, sexual function, but then also putting it back into the body, because if you're treating hips, low backs, SIs, pelvises, orthopedic pelvises, you are definitely also doing pelvic health. I like just filling in the blanks there for people who think they don't do pelvic health.
Find out more at entropy-physio.com is where you can find just a sampling of what Sarah gets to do. What are we talking about today?
We are going to be talking about DRA. Diastasis rectus abdominis, or some people call it DRAM, diastasis rectus abdominis muscle, but it's that separation that happens most frequently. It's noticed in pregnant women, postpartum women, but we're going to talk about a little bit about what it is and what it isn't, what you might be able to do to help.
All right, so you've described it just a little bit, but is there anything else you'd add? If someone were to say, hey, describe it briefly, what would you say about it?
Diastasis of the rectus abdominis muscles is basically just a stretching of that linea alba, so that connective tissue between the two bellies of the rectus muscle. The muscle bellies end up being slightly further apart than they were previously.
Is there an objective measure where something is or is not labeled this?
It depends on where you look. Kind of clinically and traditionally, we think that above 2 centimeters or approximately 2 finger widths would start to qualify as a quote-unquote separation. However, I think clinically that's not necessarily always a relevant distance. It's one of those things where the accuracy and the reproducibility of it in the clinic is typically not the best. And there are people who have a separation larger than 2 centimeters where their function is fine.
Okay.
Anatomy.
All right, so what's involved? I'm sensing the rectus abdominal muscles. I'm not really sure what clued me in there, but I'm guessing those things are involved.
Absolutely. So it's basically just the rectus muscles that are involved, typically present in women. Some people say 100% of women will experience this at some point in their pregnancy. Many women will recover very well, some women not as well as others. It is also present in some men, but that has been woefully understudied, and we have very little information on that.
All right, how do we test for it? Prove it or disprove it? What are we looking at if you've got someone in front of you, or if it's a question on the NPTE? How do you assess it?
Super easy. Anyone can do it. If you just get into a hook line position, so supine with your knees bent, you have the woman or the man cross their arms over their chest. They lift their head and shoulders, and you palpate along the midline. And you're just feeling for the medial edges of each rectus belly, and that's how you check it.
Differential diagnosis.
And now differential diagnosis. Some things look like this, some things might be similar, but how would you differentially diagnose a condition on the test like this?
So for the most part, if women are seeing a bulge or a doming in their abdomen, most of the time it will probably be diastasis. Probably the one thing I can think of that may be not diastasis would be an umbilical hernia, which that's kind of more, it would be at the umbilicus, and it would be something that you could kind of poke back in. So really all we could do was kind of confirm that there might be a separation of the muscle belly, but if you suspect an umbilical hernia, that would definitely be a referral back to their physician.
Yeah, I could see something like that coming up, similar but not the same on the NPTE. They like to ask questions like that.
Treatment examples.
Treatment examples, I'm sure you've got a slew of things, but you could talk for hours on this. But treatment examples, something that would come up on the NPTE, what do you think it's going to look like?
Ooh, well, I really, really hope what they would say, what the correct answer for this would be to exercise. We don't have strong evidence, even though there are several systems out there that are billed as ways to help reduce or eliminate diastasis or help it heal. If you get into the evidence, there's no specific exercise that has been shown to be particularly harmful or necessarily helpful for women with diastasis. However, we do have fair evidence that doing some kind of exercise is much better than doing nothing at all.
Here's your example question.
All right, so we always love samples. People want to know what they can expect on the NPTE. If you were to throw a sample question at students, what's something they could possibly see in some form on the test?
If I were asked to write a question, this would be it. Diastasis rectus abdominis is a serious pathology. B, needs surgical repair. C, possibly a normal physiological occurrence during pregnancy. Or D, strongly associated with low back pain.
All right, and the correct answer on your sample question?
Letter C.
Possibly a normal physiological occurrence during pregnancy. And that's good test-taking strategy, because a lot of times if there's a lot of words, if they're really if they're really explaining a possible answer, it's not 100%, but typically you can pay attention to that one. But yeah, possibly a normal physiological occurrence during pregnancy. It's definitely what the answer is here.
Yep.
All right. Well, appreciate you taking some time out to talk to us. Diastasis rectus abdominis here on NPTE StudyCast, Sarah.
Awesome. Thanks for having me.
Download free study guides now at ariusmedical.com/NPTE StudyCast. AUREUSmedical.com/NPTE StudyCast. Rewarding careers, experiences of a lifetime. Explore travel PT at ariusmedical.com.
NPTE StudyCast. Brewed by the PT Pintcast.